Welcome to the healthcare policy podcast that we're doing, and my hope is to just explain very briefly where things stand in the Senate today and what we hope to be able to do by way of major healthcare reform legislation in this Congress. Well, I think that there's been a growing recognition that we have major problems in our healthcare delivery system. We have over 45 million Americans with no healthcare coverage. They are able to go to emergency rooms there to get health care, but it is not an efficient way to provide health care to many of our citizens. So President Obama made this a priority in his campaign for president. He's made it a priority since he's been elected that we need to pass significant health care reform. And of course, in the Senate here, Senator Kennedy has worked for decades, literally, to bring about major health care reform, and he's anxious that we complete that this year. Senator Baucus, who's chairman of the Finance Committee, I have the privilege of serving on Senator Baucus's committee and Senator Kennedy's committee, both of which have jurisdiction to look at this issue of health care and to try to formulate legislation. So I think it is a high priority for us, and I hope very much we can pass a bill. Well, I think everyone's aware that the cost of health care is going up much more quickly than the cost of most everything else that we buy, just on a year after year basis. So we need to find ways to reduce the growth in the cost of health care. In New Mexico, many small employers just cannot afford to provide health care coverage to their employees, and we have the highest percentage of the private employees in the country who are without health care coverage, highest percentage of any state in the union. Well, I think that there are several things that need to be done. We need to reform the health insurance market. I think it's clear that we've got to get away from this current system where the insurance companies are competing with each other to avoid covering people who have real illnesses. That's not a good use of time. That's not a good policy. What we need to do is have guaranteed coverage so that everyone who's selling health insurance has to provide or offer to provide health coverage, and then we have to find a way that people are not excluded from coverage because of pre-existing conditions. We also have to get to some kind of universal system. That's been done in some states, for example in Massachusetts, through an individual mandate, where you say people have to go out and get coverage, and we will find a way to provide a subsidy so that they can afford to do so. That's the way they did it in Massachusetts. That's one of the proposals that we're considering here in the Congress. Well, I think all the experts that I've talked to say that if you're going to get a handle on cost growth in healthcare, you're going to have to expand coverage so that you have everyone under the same system. And once everyone is under the same system, then you can begin to focus on reducing those costs in a way that makes sense, in a way that's effective. That's part and parcel of what we're doing here. One of the main obstacles we have to overcome is calculating how we can both expand coverage and over the long term reduce the growth in costs. This subject of healthcare reform is going to be with us now for several months going forward, at least several months. And I thought it was useful to perhaps give a short update on where we are as we get started on this debate in a serious way here in the Senate. I appreciate you paying attention and listening to what we're trying to do, and I hope you'll communicate with us if you have suggestions.